Hi, I'm Allie Stoddard. I own greenalleywellness.com, green, A-L-L-E-Y, wellness.com, greenalleycbd.com. Okay, today we're going to talk a very important topic, and I'm getting a lot of clients with this issue. Weird neurological pain, like nerve pain on the chest, on the quads, in and around the pelvic region. It's usually bilateral, in both areas. It's not one side. We rule out trauma. We rule out any accident. We've been able to rule out any change in diet, for instance. And what's happening is our nervous system is on fire. And I'm going to give you an example of a client that I just had. He had a colonoscopy, and then he got IBS, irritable bowel syndrome, and then he got this nerve pain. And my intuition and my training says this all started from an event that was highly stressful on his body, whether it was from the chemicals, the anesthesia, from the colonoscopy, or the physical trauma to the body. For some reason, it put the nervous system on high alert. And what I'm seeing is this high alert, this hypersensitivity, this hypersensitivity to foods, to events, to trauma, to grief, to stress. We can't relate it back, but it's somehow coming we know now that this is a very big side effect that we are seeing from the COVID-19 vaccine, believe it or not. The boosters, the vaccine, all of it. What it's doing is it's telling our messenger RNA, the body, to do something, the DNA, to be hypersensitive. And so when we get to a stressful event, when we get too much toxic load, this hypersensitivity comes into effect. Okay, what do we do with it? Well, we know that part of the reason is that this endocannabinoid system, which is the system in the body that I work with, that I am an expert with, and that most physicians don't even know exists, the endocannabinoid system is in charge of bringing up inflammation and bringing down inflammation, calming the nervous system. And what's happening is our immune system is hypervigilant, hyperactive. We've got to offset the immune system by calming the nervous system, and that's called the endocannabinoid system. So for this client, his endocannabinoid system isn't working. He's very sensitive to drugs, to pharmaceuticals, to foods. Sometimes you're hypersensitive to taste or to smell or even to texture. So at that point, we need something that Dr. Blair developed just last year. It's called Beta Caryophyllene, and it's called BCPlus on my website. And it's a plant nutrient that turns on our CBD receptors. So we've got to turn on the receptors before we can jumpstart the endocannabinoid system. So we turn on the receptors, and then we use something called Will's Wonder. It's an antiviral CBD. Well, I don't have a virus. I have maybe a side effect to this vaccine. Well, for some reason, these spike proteins are having the body react to a virus, even though it's not a virus. So we do an antiviral CBD. I've helped probably about 50 patients with these problems, these type of neurological problems. Some of them can be tremors, some of them can be twitches, some of them are deep, dark pain in the middle of the night, in the daytime, but it's usually joint pain or weird pains in the area of the body that normally doesn't get pain. So we start off with the Beta Caryophyllene twice a day, and then maybe a week or two later, we start with the Will's Wonder antiviral CBD. Beta Caryophyllene is $72. That'll probably last 3 to 4 months, and then the Will's Wonder, just depends on how much you use, will last a month or two. greenalleywellness.com, Call me anytime. My phone number and information is on my website. Thanks so much.